but still you can, physician is enlightened one and he can see and diagnose and treat you. So we can read ECG, we can do 2D echo, we can do angiography and so many things. So he is a skillful person. So Buddha स्क्रीन बराबर नहीं मिल रहा है, थोड़ा लाइट बंद करना पड़ेगा, ये ऊपर वाला थोड़ा अंधेरा कर दो. For anybody, if you have observed or if you have visited Sachi, the symbol of Buddhism is around like a round circle, but there is no end to that circle. Have you observed? Yes. So there is no end to the learning also. Even you can do PhD at the age of 75 years also. So there are so many people. So Buddhism is a learning. And what is the difference between learning and intelligence? Suppose imagine a cake. The bulk of the cake is what? Self-learning. When we are in MBBS, we do dissection of the body. That is self-learning. Because the dead body is there and you are there, nobody is teaching you. That is called self-learning. So that is bulk of the cake. Then we go to MD medicine. It is called improvised learning. You go to the patient, you see your teachers are there and so it is called ice on the cake. That is called improvised learning. And when you go to DM cardiology, then you are going inside the cath lab and your bosses are there who are already doing angiography, angioplasty, pacemaker, lot of things. So that is called supervised learning. That is cherry on the ice. So bulk of the cake called as self-learning. Ice on the cake is called as improvised learning. And cherry on the cake is called as supervised learning. So Buddha had a supervised learning because he was enlightened one. So Buddha is a great physician. Why we say Buddha is a great physician? Because he was dealing with the psychiatry, like Abhidhamma Dr. Kumar Kamble is there, and diseases of the body also. The Buddha and the physician has said they got similarities in their role as a healers and their focus on the eliminating suffering. Why Buddha left home? Because a couple of days back I was in Mumbai and we had a discussion. All non-Buddhist doctors, what they know about the Buddha, that he left the home after seeing the dead person, after seeing a very sick patient, and because of that he left the house. But it is not like that. If you read Mahabhishraman, then you will understand what was the root cause for leaving his house. Just to find what is the truth. Why the people are fighting? Why one king is fighting with the other? Why son is fighting with the father? If you read today's newspaper, every time there are conflicts and murders. Husband kills the wife, then wife kills the husband, son kills the father. So this is because of the lack of Buddhist education. If you do Buddhist education, such thing will not happen in Sri Lanka, Vietnam, or Cambodia, or Buddhist countries. They live with the peace. So both aim to diagnose the illnesses, determine their causes. Just like dependent origination or Paticca Samutpad. Why I am there? Because my parents were there, their parents were there, and then evolution. So prescribe remedies. When patients are coming to us, they are getting chest pain. As a physician, my first is do your ECG. If ECG is normal, do troponin test. If it is normal, then go for angiography. Then if there are some problems, you go for angioplasty or bypass surgery. So ultimately, seeking to the bring about the healing and well-being, and furthermore, both the roles emphasize empathy. Empathy is very, very important. Compassion and ethical conduct. Who was Buddha? He was a great physician who treated person's mind and body and proceeded in a scientific manner by analyzing the disease. It is not like Ramdev or anybody that you take my medicine, you will be alright. But it should be scientific. So he was a founder of Buddhism, enlightenment, and became troubled by the human misery that he saw around him every day. Buddhism arose as a result of Siddhartha Gautama's quest for enlightenment, and the two main Buddhist sects are Theravada, Mahayana, and others. Buddhism is a spiritual tradition that focuses on the personal spiritual development and attainment of the deep insight into the true nature of the life. This is a great physician, Osler. These are the doctors of modern, and these are the team of doctors, just like we are having Indian Ambedkarite Doctors Association. Similarly, there are so many societies like Cardiology Society, Indian Medical Association, and so many organizations, because we are working like virtue principles, meeting together, sitting together, discussion, what are the things to be learned from the others. So without association, we cannot work. So Buddhism, what is we call BDS, B for Buddha, means teacher, D for Dhamma, Dhamma means syllabus, and then Sangha means association. So these are the associations. One man cannot do anything. Dr. Mangesh Devali conceived the idea of organizing this conference. He has contacted so many persons, he took the efforts and he has collected everybody, and these are the results. So All India Bhikkhu Sangha. So Buddhism teaches that life is interconnected. So when the candles are there, they are also interconnected. If you see the light, there is a thread, there is a called as everything is there. There are three things. Why we light? Because can you see how you are seeing me? By your eyes. Can you see me in the night if there is no light? Can you read it without light? So we cannot see only with the eyes, but we require light. And that light was given by whom? Buddha. So Utkrantavad is very, very important. And medical science also believe on evolution. From the gases, then amoeba, and then evolution, that vertebrate and all that. So this Darwin's theory of evolution. So Buddhism is therefore not centered on the relationship between the humanity and God. So that is called Dhamma. Dhamma means relation between the two human beings, man and man. So that is called Dhamma. And Dharma means there is a God, existence of God. If you accept the existence of God, then it is Dharma or a religion. Everything is changing. If your patients are coming with a dengue fever, platelet count was 50,000, 20,000, 10,000. So every time there is changes inside your body, we can count that to the electron microscope. You can see trypanosoma, you can see COVID virus, but is there any parameter to see your thoughts? What thoughts are going inside Bandej's mind or my mind? There is no parameter for that. But there are so many thoughts. It is like a software. This is called Anittavada. This platelet, RBC, they are changing. Life of platelet is only 10 days and 120 days for the RBC. So Buddha was asked, are you a God? He said no. Then are you a healer? He said no. Then are you a teacher? The student persisted. He said no. I am not a teacher also. So then what are you? He asked the student. The student asked the Buddha, then what are you? I am awake. Now there are so many people here. In the class also, when the professor is teaching, there are front row is awake. What about backbenchers? When we go to the conferences after the post-lunch session, we will see most of the people, they will be in the slumber, deep slumber. So we don't want to be in the slumber, we should be always awakened like the Buddha. And Dr. Baba Ambedkar was also awake till 2 a.m. in the morning for us. So Buddhism teaches that beings are sick and Buddha awakened ones are physician. Just as a physician would have a different cure for the each disease, the Buddhas have different teaching for the different beings. If you see psychiatry, then mania, schizophrenia, depression, anxiety, suicide. So person is normal, but after 1 hour he will do suicide. So what are the things, what are the storms inside the brain? Only psychiatrist people they would understand. And doctor, it is a Latin word. What is by doctor? It is a Latin word called docere. Docere means teacher. So Buddha was a teacher. Physicians are also teacher. We get the training from our seniors that these are the norms, these are the histories. So they teach us all. So physicians should also be awake for the diagnosis by taking history, then doing examination of the patient, and then investigations. Whether ECG is required, whether blood tests are required, whether malaria, cholera, there are so many microscopic treatment and prevention. So it is just like examination or eha passiko. Buddha was also saying that you don't believe on your teachers also. Don't believe on your parents also. Don't believe on anybody. Just ask the question, why this, why this, why this. And that is eha passiko. when there are some dead bodies in the autopsy room, the cause of death is different in different dead bodies. So that is the postmortem examination done by the forensic expert. The second meaning indicating something which seems to remain hidden or which relapses and get covered also itself only in the discourse according to the historical process to the perspective theory and the views. Now what are the Buddha's doctrine? Most of the people they ask, Buddha sat below that ficus religiosity and he got the enlightenment. But suppose I go and sit there below that tree, suppose I go to Diksha Bhumi and sit there, I will not get enlightenment. So it requires some time. And what he discovered after the enlightenment? 4 noble truths. Panchashil, 8-fold paths, Paticca Samutpad, 10 Parmitas, 10 fetters, 84,000 suttas, and they are all compiled in the Sutta Pitta, Vinay Pitta, and Abhidhamma Pitta. I called Sutta Pitta for the common people like us, then Vinay Pitta for the monks, and Abhidhamma Pitta for the superhuman beings like psychiatrists. Why I called superhuman beings psychiatrists? Because they are dealing with the mind. You may be intelligent. Intelligence and mind, they are two things. Who is more? What is the difference between intelligence and brilliance? Are you brilliant or intelligent? Intelligent. Intelligent person is focusing on only one thing, but brilliant people will focus on most of the things. So intelligent people they are deriving the principles, and brilliant people they are following the rules. The 3 basic doctrines are dukkha, suffering, anitya, impermanence, and anatma, there is no soul. And what is the fundamental cause of suffering? Krishna is desire. Therefore, extreme with the self, don't obsess about oneself. Kam Krishna, like Asarabha, Bhava Krishna, Kejriwal, and Vibhav Krishna is Modi, because he is concentrating on the opposite party. That they should not be in his path. That is Vibhav Krishna. And working on the opposite party to destroy them. So first noble truth, there is suffering in the world, and to Lewis we know this. The cause of suffering is self-centered desire, that is dharma, and the solution to eliminate the desire, just like bypass surgery. And what is the prevention? Don't eat fatty foods, don't eat dairy products, don't eat so many non-vegetarian food, grain, meat, and all that. That is prevention also. There are vaccines and medicine like statins, anti-hypertensive drugs, diabetic drugs. So these are given by the Buddha. So first, everybody is asking why this. Is it a depression? Because Buddha said dukkha. With other religions, they think it is a depression. But Buddha was correct. Why there is suffering? Because birth is suffering. When there is a young couple getting married and getting a son, they should be happy. But Buddha says, who is a sufferer? That boy. Because he was for 9 months in their conditioned room, in the womb of mother, enjoying everything at the free of cost, there is no tension. But after delivery, the first thing doctor does, they cut their umbilical cord, that pain. Then the nurse slap on the back, then it cries. So that it starts the suffering. Then aging, illnesses, death, fear of death. In the corona, everybody has experienced fear of death. My neighbor has died, I will also die next day. So union with the what is this disease is suffering. Means the अप्रिय लोकांचा सहवास हे दुःखाचं कारण आहे आणि प्रिय लोकांचा सहवास हे सुद्धा त्यामध्ये महत्त्वाचं आहे. The origin of suffering, we always want something. Young people, they are interested in their sexual activities, or they are watching some movies or something, going to the various centers and getting a lot of diseases like HIV or AIDS or so many things, or gonorrhea or syphilis and so many things. Materialism, car, Maruti car or Mercedes, food like McDonald's, good times with friends, health, immorality and youth. The end of the suffering, that is concept you are carving, stop wanting, this will also lead to the nirvana. And the way leading to the cessation of the suffering, that is the most important. What is the treatment for this? That is right eightfold part, samadhi and all this. Right view, intention, speech, action, will, effort, mindfulness and right concentration. So for any physician, suppose you become MBBS, So he should know what is the right. Suppose patients are coming to us. First of all, you should treat like he is a brother or a sister. Suppose young girl is coming, she is my daughter. More than that, she is my sister, and elder one is my mother. That feeling should be there in the mind of a physician or a doctor. So Buddhism recognizes that we must live or live in a practical reality of this world, not in an imaginary world. So Anatta means no self, and doctrine of Anatta is Buddha's most unique and radical teaching. So what we assume, we usually assume that beyond our changing body, mind experiences an unchanging and unique ego, that mind is everything. Because if mind is good, I am here. But if mind is bad, I should be in the mental hospital. They are also human beings. They are also normal. If you go to the central areas, they are also human beings. So your mind is everything. Impermanence, I told you. Buddha and doctors believe on the change. Nothing is permanent. That is Sarvam Chanikam, Anityavad, Anatmavad. Buddha denied the concept of what? We also doctors, Dr. Kumar Kamble or psychiatrists or any surgeon or a bypass surgeon, they don't believe on God. They do the surgery. If anybody coming with the appendix, they go open the abdomen and remove the appendix. So there is no God, no soul, no heaven, no hell, no rebirth, no superstition and dogmatism. So these are the 5 very, very important principles. Even medical science also does not believe on such imaginary things and believe on the DNA, RNA, because it is scientific. There is electron microscope. You can see one small molecule 10 or 1000 times more, and you can name them. It is a bacteria, virus, or which are the, you can name them also. So man is the center of everything in both Buddhism and medical science. So what are the similarities between Buddha and physician? Buddha is a great physician, always believe on learning, knowledge is supreme, doctor is also continuously learning. I have given 523 CME lectures and social lectures also more than 150. So learning, teaching, learning from others. We can learn so many things from the nature also. Suppose you go to the jungle, you can see these birds also there. Everybody is following the law of nature. Suppose you take the example of honeybee. It will get up early in the morning, go to the flower, takes very small nectar and she will give the result. Even small birds, they are also there. Everybody is busy in the nature. So doctors are also very busy. Doctors do not become by birth. Because I am doctor. My father was not doctor. I am doctor, so I have 2 sons. They should also become doctor without going to medical college, without doing NEET examination. But no, they have to go to the 12th examination, pass their NEET, super specialty. My one son is DM cardiology, gold medalist. Another one is MS orthopedic, he is also gold medalist. So they have to do efforts on their own. It is not like that you go, he is a doctor, Khobragade son, he should be passed. It is not like that. So even monks also, they are not born. They have to take the training proper. They have to take the pravacya. They have to go to their seniors and they have to follow the Vinaya 227 rules. So doctor, not by race hierarchy, they require highest intelligence from the childhood and efforts are very, very important. If you don't do efforts, you will not become anybody. Proper basic scientific education, guidance from the seniors, surgery, usually our seniors they teach us how to do the surgery, bypass surgery or coronary surgery. Proper teachers should be there. Ability to learn things by healthy mind and brain. And Buddha is a great physician because we don't believe on greediness, selfishness, quality to sacrifice the family life. Even we get a call at 3 o'clock early in the morning, if gynecologist is there, she gets a call, you have to attend that call. If a patient of heart attack comes at early 4 o'clock, you have to go and attend and save the life. If a patient of schizophrenia is not controlled by anything, they will call the psychiatrist and they will manage. So continuous day and night alertness, awakeness, interest in sick people. Monks, they also take interest in the sick people. Even Buddha, he went to one monk and he has washed with all the dirty things and he has given the advice that why he was neglected because he was not paying attention to the others. So learning was you pay attention to the others, others will also pay attention to you. If you love the people, people will love you. If you hate the people, people will also hate you. So vigorous training, continuous training, interest in the sick people, love towards the humanity, and secular attitude and no discrimination. Even animals are also useful. You see that Sarvamitra people. They don't kill snake. But the lay people, what they do, if the snakes are there, they will kill it. But the scientists, they will bring the snake, take out the poison and make the vaccine against that and will save the life. So Buddha dealt with reality, not imagination. Doctor deals with the facts and findings based on his knowledge and no scope to mythology and superstition. Have you seen any doctor believing on mythology or superstition? Why sickle cell patients are dying because there was this. Because there is a hypothesis. Malaria hypothesis is there. So there are evidences. We are practitioners of modern medicine and we have to give the evidence that how this patient has died. Otherwise there are multiple laws, medical practitioners, laws are there and you can be sued in the court of law if you do the negligence or if you do the malpractice. Everything has a cause. Assumption that there is pain and sorrow and misery and the assumption that everything, no matter what, has a cause, are the only two assumptions that Buddha made. Buddhism is a peace of mind. More significantly, Buddhists have greater concern with the peace of mind. Why Buddha left his house? For the peace of mind. Shankar and Khobragade, they are fighting every year, just like India and Pakistan or Kashmir. So similarly, they are also fighting for the water. And every year, 25 people from the Shankar, 25 people from the Khobragade, they used to die. And when Senapati had asked you to fight, Buddha said, no, you may be in the majority, but I am only having one vote, I am in the minority. But I am opposing you not to fight. I want to find the solution for that. So what was the Buddha's objective? Buddha had no quarrel with anybody. But still, there are some people who trouble him, like Devadatta. So in your neighbors also, your surrounding also, these are Devadatta phenomena. Suppose somebody troubling you, you say that he is Devadatta. So his objective was to satisfy immediate needs for the overcoming pain and suffering. The root suffering is attachment to anything. The cause of all pain and suffering is ignorance. Ignorance is the biggest poison. There are three poisons. One is ignorance, attachment and anger. So knowledge is supreme. So you always educate others. Suppose doctor and good doctor. What is the difference? Doctor is practicing, but if he is not teaching to others his skill of surgery. There are so many doctors in our medical college and they discriminate. This is from scheduled caste, this is from Buddhist community, and they will not teach you surgery. They will go, you go to TB ward, you go to others. So you will get TB and you will get killed. But what they do with their persons, suppose is a person from their community, higher community, they will teach purposefully and he will be a surgeon or a great cardiac surgeon. So pain is very important. Story of wounded swan in the childhood of the Buddha. That swan was wounded by Devadatta and Buddha saved the life. So what is the difference between rules and principles? Rules are like recipes. You open any TV or your channel how to cook biryani. That is all rules are there. You follow these steps. So these are the rules. But principles are different. We have to apply in a difficult situation. Suppose surgery is there and he build a heart transplant surgery. So he has to use his own mind and will follow the principle. So rules and principles are different. What are the principles of religion? So religion is full of rules. All religion, you see any Muslim community, they will go to the masjid for 5 days and they will follow the rules. Or any, even in Kumbh Mela also, these people around 50% of India, they have gone inside the Ganga and took the bath. Why? Because they said all these things will be washed away. So this is called dogmatism or superstition. So religion set the rules, but the Buddhism is not a religion, so it has a principle. What Baba Sahib said, religion must mainly be matter of principles only. It cannot be a matter of rules. That's why Baba Sahib has embraced Buddhism, not Islam, not a Christianity or a Sikhism or Jainism. The moment it degenerates into rules, it creates to be a religion, and as it kills responsibility, which is an essence of the true religious act. So why do we need principles then? Generally speaking, they help humans live in a harmony with other and human beings and nature. They are universal, can be applied without exception, and can cover different aspects of our life, such as family, couple life, friendship, relationship and love. That's why principles are there. And we read the most important books in native medicine called as Harrison's Principles of Medicine. So people who share common principle can create greater understanding, just like Mangal Dayode, and mutual respect and work together to achieve the common goals. That's why Tamanna has come from Ahmedabad here. That is because of the principles, not for the rules. So principles are moral rules or strong beliefs that influence our action. So doctors and monks, they also believe on the principle. In other words, the principle set the foundation and provide guidelines for our decisions, actions and behaviors. Upon the principle promote ethical behaviors. Ethics are very, very important in medical practice. That's why after passing the MBBS, we get the Hippocratic oaths. We have to follow the ethics. They represent our fundamental beliefs about the right and wrong and help to make the informed and quick decisions in every aspect of our life. Principles are important because they provide clarity and direction, and our core principles which we accept and consider to shape our understanding of the world. Theory of evolution in Buddhism, because theory of evolution is very, very important. Buddha said there is no chamatkar. We are there because we are evolved, Krantava, and everything is made up of particles. He has given the example of zygote, sperm, ovum, and everything. So Buddhism and medical science is scientific. Science and Buddhism, they are ethical. Ethical relationship was scientific truth and about the nature of the moral value. So of course, there are those who still cling to the dogmas in the face of the science, like that Raphael. You have seen that Raphael and that Limbu was by our Home Minister. That was Defense Minister. So we should not do that. So embracing ethical behavior or pathway to integrity and success. So these are the ethics. So ethical behavior is Buddhism, medical science is also ethics, and it encompasses the honesty. Doctor should be honest. He should not be a cheater. Then empathy should be there. He should involve in your family. He should take care of your family. I call a person lucky when if he gets a good husband, a good wife, or a husband and good doctor. Because your all secrets are known to your wife and to the doctor. Even he is a Prime Minister of India, but all his sufferings, all his secrets, all his reports, cholesterol, lipids, ECG, angio, they will be known to his personal doctor. So, if you are lucky, you should get a good wife and a good doctor. Otherwise, your life will be in the misery. So, first interest, responsibility, respect and harmony, all aspects of life. So, all these monks and doctors are similar. Doctors are with the white coat. Monks are with this yellow or their chewer. So there is a dress code for them also. You see the similarity between the monks and the doctors. They are also teaching. They are alert always. So these are the things. And there are some fetters also. Why I am showing this slide? Because doctor is honest. They will not charge 50,000 for determining the sex of the child, whether it is a male or female. Any Marwadi people coming and having 4 daughters, and for the 5th time they are coming and we give 50,000 to the person that please tell me what is the sex of this child. But if doctor is honest or Buddhist doctor, they will not disclose. No, this is unethical. I will not accept your money, but I will not disclose this will be male or female. So that is morality. Buddhism and science believe on the morality. What place would Buddhism occupy in such context? And these are the things. Doubt. You should have always doubt in your mind. Why this? Why this? Buddhists believe on the causation theory. That is called dependent origination or paticca samutpad. That is a separate chapter actually. And what Buddha realized? The man who helped himself would inevitably help others, like Dr. Mangal. He comes concretely to deal with the problems of society and personality. Because they are sacrificing their family time. They are sacrificing their personal life and coming for the society. So what is most important is, I told no soul concept, life is after death. Is there a life after death? There is no life after death. What happens to the suppose patient of 106 degree fever is there and he dies? Where that 106 degree temperature goes, it goes to the nature. All is solid, liquid, gases, which were taken from the universe, they will go to them and they will form another life, but not as a human being or a similar person who died. Kalam Sutta you must be knowing. Vajji principle we know. Similarly, we are organizing CMEs, conferences, learning, giving knowledge to the others and all that. So, these are all concepts of continued medical education they are taken from the Buddhism only. What is teaching of Buddha? Do not accept anything because it is remote, so because it is the traditional belief or because the majority vote, so deny all the concepts. Buddhism and medicine follow principles, like I said. So Buddhism and medical science code of conduct, not a religion, like Khobragade father of medicine. Medical practice video on the Khobragade code. This is in detail. Buddha, father of mankind, is Margadata, not Mokshadata. When I took admission for the MD or MPhil, I want the guide. Similarly, Buddha said, I am your guide, and Buddhism is your syllabus. So both believe on the morality, science and truth. Truth is the ultimate, morality is unity. Basic principles of Buddha are same. And medical science is nothing but code of conduct, like Buddhist Vinay Pitaka rules for the monks, no feeling unknown. Buddha used Vinay principle for the monks. And what are the discoveries I told? Panchashil for a personal development. And the Ashtangik Marga for also you are getting for relieving your bliss. So this is a Panchashil, Ashtangik Marg, that is called wisdom, ethics and samadhi, we know it. So Buddha and physicians believe on the pragmatism, naturalism and not idealism. Do you know what is pragmatism? Pragmatism is doing experiments. Like you go to the laboratory, take hydrogen and oxygen, you make the water. Or creating H2SO4. So that is pragmatism. You do the experiment. What Christian Bernard has done in 1969, he used to bring this bears from the jungle and he used to take the heart of one and transfer to others. But after 40 experiments, he was successful in transplant of the heart. The first heart transplant was done in the Cape Town by Chris Bernard. So this is called pragmatism. Idealism is early morning, meeting to the temple, worshipping the god, ringing the bell and doing all this Satyanarayana, all this puja. So that is called idealism, worshipping the god. Naturalism means we believe on the nature. Vinay Pitaka, what is Vaishajya's conduct, that is wrong. And similarities between the Buddhist medicine and the modern medicine is also there. In modern medicine, there are psychotherapy, just like psychiatrist people, behavioral therapy, cognitive therapy. There are various therapies and various tests are also there. Modern medicine for prevention having vaccine. You might have seen that Sputnik vaccine or COVID vaccines. Antibiotics are also there. Drugs are also there. Chemotherapy, surgery, anyone. So root, plant, life medicine and fruit medicine. These are the at that time medicine. So Buddha said, eat the food which contains already medicine. Even your doctor says, eat the apple daily, you will be away from the doctor. So achar, vichar, ahar and vihar. These are very, very important things. Your behavior should be proper, politeness. Your thoughts should be fruitful. And your diet should be proper. If you take wrong diet, you can have coronary disease. And your place, it should be also proper. Concept of charika. Suppose any heart patient, doctor says you every day go for the 45 minutes walk. Even Buddha tells to the 4 monks that you go to the 4 directions, not 4 people going together. So meditation and shaving of the head. Why? Because there are so many diseases. It is attachment to your hairs and your most of the time is wasted there. Then eating once in a day just to prevent the various gastrointestinal diseases like inflammatory bowel disease, Crohn's disease, ulcerative colitis, tropical. There are so many gastrointestinal diseases. Everything goes inside to the mouth only. This is the gateway of India. So not eating too much is also very, very important. I follow the commode philosophy. What is commode philosophy? What commode does? We go sit on the commode, pass our stool, and then flush that flush. And commode is clear. So our body, whatever we eat, you go for the exercise, digest it properly, and next day you should not deposit it in the fat. So that is commode philosophy. Sharing food should not be never wasted. If you invite the monks and call them, so they will eat everything properly, but they will ask only limited food and they will not get overeating. Then overeating, patient coming with the diarrhea, 40 times, loose motion, vomiting and everything. Not to waste the food. So Buddhist and psychiatric, Dr. Kamla sir will cover it, I am not going to do that. Practical positive attitude and device, I one another 5 minutes. These are the various psychotherapies by Buddha, Angulma, how his mind was converted, Isa Gotami, Amrapali, these are all the things. Puttapala and Pasanjit, these are all, Panmikas are also there, and haters in our personality. There are around 52 chittas and 89 chitta sakas. So these are all Abhidhamma Pitta. And haters, it's sweet papers for your development. So concept of autopsy in modern medical science, I have explained this to you, and these are the various steps of Paticca Samutpa, because it will take more time, and I think my time is getting finished. So I will conclude my talk and summarize. I told these are the 3 poisons. So with this, I would like to finish my talk by wishing you all again happy Vaishak Purnima and happy Eid to all. Thank you very much for your kind attention and listening to me. Thank you. Can you have a